So drugs acting on cardiovascular system. In this video, we'll be studying about the drugs acting on cardiovascular system. So usually you need to have some idea about what are the cardiac diseases. So first, that is drug used in congestive cardiac failure. Second, that is anti-arrhythmic drugs. Drugs used in angina pectoris, that is chest pain we can say. Drugs used in myocardial infarction. So fifth one, antihypertensive drugs. So this is congestive heart. This is normal heart. So this is in this normal heart we can see that everything is perfect. This is normal ventricular chamber. This is ventricular chambers. Fine. This is a congestive heart on the right side of the image. You can see that in this ventricular, left ventricular region, there is thickening of ventricular chambers and smaller filling capacity and ejection of blood. So there will be a decreased blood ejection, cardiac output from the heart due to congestive heart. Drugs used in congestive cardiac failure. First drug we will be using, that is diuretics. For example, furosemide and bumetanide. Vasodilators. Example, that is ACE inhibitors, angiotensin converting enzyme inhibitors. Hydralazine, CCB, that is calcium channel blockers. So it will be used as in vasodilators. Third one, positive inotropic agents. So first positive inotropic agent is a cardiac glycosides. Example, digoxin. B, that is beta adrenergic agonist. Example, butamine. C, that is phosphodiesterase inhibitor. Example, amrinone. Cardiac glycosides. So which is very important in exam point of view. So what is the mechanism of action of cardiac glycosides? This will be asked in 5 marks in your examination. Cardiac glycosides inhibit the sodium potassium ATPase. So there will be intracellular retention of Na plus followed by increased intracellular calcium 2 plus concentration through the effect of the sodium calcium exchanger. So here is a flow chart of mechanism of action of cardiac glycosides. So whenever this cardiac glycoside is prescribed to any individual, so this inhibits sodium pump. So because of inhibition of sodium pump, there will be accumulation of intracellular sodium. Fine. Because of accumulation, one side we can see that is prevents extrusion of calcium, and another side that is increased calcium entry through calcium channel. And because of both of this cause, it will lead to increased intracellular calcium, and that will increase force and velocity of contraction. So which is calcium is very important component to increase the force and velocity of the heart. Pharmacological action of cardiac glycosides. So first action is in the cardiac and second one is extracardiac action. So in cardiac action we will be studying one is positive inotropic effect. What is positive inotropic effect? That is cardiac glycosides are cardiotonic drugs. They increase the force of contraction of the heart. The stroke volume increases and thereby the cardiac output. The systole is shortened and the diastole is prolonged, which allows more rest to the heart. The ventricles are more completely emptied because of more forceful contraction. The heart rate is reduced. And third is that is the effects of electrophysiological properties of the heart varies with dose and in different parts of the heart. Digitalis depresses AV conduction and enhances automaticity of the ventricles and Purkinje fiber cells. Digitalis also produce the characteristic of ECG changes. So digitalis is nothing but it is digoxin. Blood pressure action, that is no significant effect in congestive cardiac patient. Pulse pressure may increase. So in blood pressure we can see changes of pulse pressure may be in an increased level. Coronary circulation improves due to increased cardiac output and prolonged diastole, during which the coronaries get filled better. So if we see, because of this cardiac glycoside, this drug, what it does is it enhances the function, it increases the function, it ensures that the heart pumps in a proper way. Second one, that is extra cardiac action. So kidney diuresis occurs which relieves edema in congestive cardiac patient. What is diuresis? Diuresis is nothing but the increased excretion of water from your body through urine, that is diuresis. So this cardiac glycosides act as a diuresis also. And CNS, high doses stimulates CTZ, resulting in nausea and vomiting. So if we give in a high dose, it will act on CNS system, central nervous system. Because of that, we will have nausea, that is vomiting sensation and vomiting. Treatment of toxicity. Stop digitalis. Oral or parenteral potassium supplements are given. Ventricular arrhythmias are treated with IV lignocaine. Bradycardia is treated with atropine, and supraventricular arrhythmias with propranolol. In severe toxicity, anti-digoxin immunotherapy, that is anti-digoxin antibodies, is now available. It can be life-saving in severe digoxin overdosage. Calcium channel blockers. So the pharmacological action of calcium channel blockers. Thus, by blocking the entry of calcium, calcium channel blockers reduce electrical conduction within the heart, decrease the force of contraction, that is work of the muscle cells, and dilates arteries. So that is why it is also known as a vasodilators. Dilation of the arteries reduces blood pressure, and thereby the effort of the heart must exert to pump blood. So what are the uses of calcium channel blockers? First one, that is high blood pressure. Second, that is angina. Third, that is abnormal heart rhythm. So in all these three conditions, calcium channel blockers are used. So this is cardiac arrhythmia. You need to know what is cardiac arrhythmia. Before that, this is normal heart in the left side of the image. This is SA node, this is AV node, this is bundle of his, and this is Purkinje fibers. So this is normal heart. Impulse generation. This is atrial fibrillation. In this, what happens from a SA node, AV node, there will be rapid ventricular impulses. Because of rapid ventricular impulses, so there will be a chaotic signals. So because of that, there will be atrial fibrillation impulses. So that causes cardiac arrhythmia. Cardiac arrhythmia is nothing but cardiac is heart, arrhythmia is abnormal heartbeat, heart and heart rhythm. Second one, that is anti-arrhythmic drugs. So first one, class 1, that is sodium channel blockers. Second, class 2 beta blockers. Third, class 3 potassium channel blockers. Fourth, class 4 calcium channel blockers. In this picturized image, we can identify that this individual is having chest pain. Drugs used in angina, that is angina pectoris. First one, that is nitrates. Example, nitroglycerin, isosorbide, dinitrate. Second, calcium channel blockers. Example, verapamil, amlodipine, nifedipine. You can remember it as chill pills for calcium channel blockers. Beta blockers, example, propranolol, atenolol. Atenolol is a widely prescribed drug in hospital settings. Fourth, potassium channel openers. Be careful while reading openers, not blockers. Example, nicorandil, pinacidil. Fourth one, drugs used in myocardial infarction. You need to remember it at any cost. First one, thrombolytics, antiplatelet agents, nitroglycerin. Fourth one, beta blockers. Fifth, angiotensin converting inhibitors, analgesic, oxygen, anticoagulants. 9, that is vasodilators. Natural ways to lower blood pressure. So why we are studying this? Because in your day-to-day life you need to know how to lower your blood pressure. That is one thing you can do, that is dark chocolates, which can help you, and meditation, eating garlics, omega-3 fatty acids, which is enormously present in eggs, and you can drink green teas, and this is you need to find. Fifth one, antihypertensive drugs. First one, angiotensin converting enzyme inhibitors. Example, enalapril, lisinopril, perindopril. All these are chilpril drugs. Second one, angiotensin 2 receptor blockers. Losartan, valsartan. Third one, calcium channel blockers. Example, diltiazem, nifedipine and amlodipine. Fourth one, diuretics. Example, amiloride, furosemide, indapamide. Fifth one, beta blockers. Atenolol, metoprolol, propanolol. Sixth one, alpha blockers. Example, doxazosine, prazosin. Seventh one, vasodilators. Vasodilator reduce blood pressure by dilation of blood vessels. Example, hydralazine.